Hello, my name is Maureen Revels and I am the Director of Midwifery at the Midland Regional Hospital in Portlaoise. I'm talking to you today about the maternity services we provide here in the hospital. We work with a range of healthcare professionals including dietitians, physiotherapists, medical social workers, to name a few of the services available should you require them. We are currently developing our midwifery-led clinic, which is available to women who have a low risk pregnancy. If you have any questions, you can talk to your midwife during your antenatal visit. The mychild.ie and whatsupmum.ie websites are excellent resources available for pregnancy, labour and baby care information. We recommend as a hospital that all women are vaccinated against COVID-19 to protect both yourself and your baby against COVID-19 infection.
My name is Dr. Miriam Doyle. I am the obstetric clinical lead at the Midland Regional Hospital at Portlaoise. Together with my four colleagues, Mr. Hossam El-Kanini, Dr. Niamh Maher, Dr. Annabella Serenito and Dr. Shobha Singh, we provide the consultant obstetric service at MRHP. You will be allocated to the care of one of the consultants. Each consultant provides a weekly antenatal clinic. 4 are general clinics and 1 is a specialised clinic. This clinic is the combined obstetric endocrine clinic, otherwise known as the GDM clinic. Women with a history of pregnancy diabetes usually attend the clinic from their first visit. The care of women who develop diabetes during their pregnancy will be transferred to the GDM clinic. Our endocrinology colleagues, together with assistance of the clinical midwife specialist and dietitian, manage the diabetic aspect of the clinic. A new midwifery-led clinic is being developed to provide care for low-risk women. This is a welcome addition to the current care options available. All women will have a formal scan at their booking visit. All women are offered an anomaly scan at approximately 20 weeks gestation. The obstetric consultants provide cover on a 1 in 5 basis for women admitted to the hospital. This means there is always a consultant on duty. However, the consultant on duty when you're admitted may be a different doctor from the consultant at your clinic. We work closely with other medical consultants, particularly the anaesthetic service, who provide the epidural service for pain relief in labour and anaesthesia for women who require a caesarean section or other procedure in theatre. We also work closely with other medical colleagues in radiology, medicine and surgery. Our paediatric and neonatal colleagues provide care as required for your newborn babies. While most babies will not require immediate review after birth, every baby will have a paediatric review prior to discharge from hospital. Resources such as mychild.ie and whatsupmum.ie are helpful in addition to the advice available from the team when you attend the clinic. We encourage all pregnant women to avail of the COVID vaccination, flu vaccination and pertussis vaccination.
Hello, my name is Emma Mullins and I'm Clinical Midwife Manager in the Maternity Department here in the Midlands Regional Hospital, Portlaoise, and I would like to welcome you here to our unit. The midwifery unit is situated on the 2nd floor, and along with our delivery rooms we have a lactation room and the Willow Suite, which is a bereavement suite designed specifically for women and their partners who have had a pregnancy loss. Midwifery care in the maternity department aims to deliver safe, high-quality, woman-centred care. Giving birth is one of the most significant, rewarding and positive life experiences. Childbirth is viewed as a normal physiological process. Midwifery care is provided in partnership with the woman and her partner and in collaboration with other healthcare professionals. On the corridor before the delivery suite, we recommend the hopscotch station. This is a useful tool to help and support you on your birthing journey. The delivery suite offers a home-from-home environment whereby women can avail of various birthing options, such as the multi-track chair and sling, the birthing stool, the birthing ball and the peanut ball.
Hi, my name is Susan and I am one of the midwives here at the Midland Regional Hospital, Portlaoise. Today I want to talk to you about midwifery-led care and our midwifery-led antenatal clinic here in the hospital. Midwifery-led care is when a midwife is your lead healthcare professional who will look after you and your baby throughout pregnancy, labour and birth. Once you are referred to the hospital by your GP, you will meet a consultant obstetrician who will discuss the option of midwifery-led care with you and see if you fit the criteria. The criteria is you must be between 18 and 39 years of age at booking. You must have an uncomplicated pregnancy to date. you have no significant medical or surgical history, and your BMI is less than 30 at booking. If you meet this criteria and choose this option, the consultant will refer you to our service. The benefits offered by midwifery-led care are that you will be seen by the same midwife throughout your pregnancy, which research has shown improves pregnancy outcomes, breastfeeding rates, and overall satisfaction in the service. We have a designated labour room for women attending our midwifery-led service, which offers a more relaxed and homely environment for labour and birth. You will still receive combined care with your GP and routine antenatal scans. If you would like to know more about this service or have any questions, please talk to one of the midwives.
Hello, I'm Claire Fitzpatrick, a clinical midwife specialist in lactation at Midland Regional Hospital, Portlaoise. Breastfeeding is incredibly important to you and your baby's health. It protects you from bleeding, cancers, heart disease and diabetes, and it reduces your risk of postnatal depression. Breast milk is the perfect food for your baby, tailor-made to meet their growing needs. The evidence shows that breast milk will boost your baby's immunity, providing the perfect balance of nutrients. It really is liquid gold, totally unique to your own baby, adapting and changing all the time to meet your baby's needs. The most important preparation you need to do for breastfeeding is to attend an antenatal breastfeeding workshop if you can, so that you can know what is normal and what to expect. If you know what's normal, you can get help when it's not. So do book in with your midwife for one of my antenatal breastfeeding workshops.
My name is Yvonne and I'm Clinical Midwife Specialist in Ultrasound. Myself and my colleague Aideen performed a majority of the booking and anatomy scans in Portlaoise Hospital. The booking scan is done at your first appointment in the hospital. This helps us to determine when your baby is due. This is often the first scan people have and they get to see their baby's heartbeat for the first time. The anatomy scan is done between 20 and 22 weeks. This is a top-to-toe check on your baby. We look in detail at the structures in your baby such as the brain and heart, and also check to make sure your baby is growing normally. Sometimes we might see something on scan which might need a second opinion. If this happens, we talk to your consultant and sometimes organise a referral to the Coombe Hospital for a second opinion with a fetal medicine consultant. The fetal medicine consultant is an expert in ultrasound and will advise you if your baby needs any further screening or tests. If you want to know the baby's gender, you can find out at this appointment so long as the baby is cooperating. If your baby is in a good position, we will take pictures for you and your partner to bring home and share with your family.
Here at the Midland Regional Hospital Portlaoise, we want to ensure that you have the best possible experience of pregnancy and post-birth. My name is Dr. Kat Hines and I run the perinatal mental health service here. Pregnancy is a time of great change, physical, emotional and psychological. It's important to be mindful of your emotional health and well-being during this time. It is normal to feel a wide range of emotions, including excitement, joy, worry, stress and responsibility. You are also pregnant during a very unusual time, a global pandemic, which contributes to new and unexpected challenges. You may need additional support in relation to your mental health if your symptoms persist for more than 2 weeks, if your symptoms interfere with your ability to work or carry out your usual day-to-day activities, if your symptoms cause considerable upset and distress, or if you have suffered from mental health difficulties in the past. Mental health difficulties in pregnancy and after the birth of your baby are relatively common. Up to 1 in 5 women will experience a mental health problem in pregnancy or in the first year after birth. If you have suffered from a mental health problem in the past, you may be more vulnerable to relapse at this time. There is nothing to feel ashamed of. With the right help and support, you will get back on track and begin to grow in confidence as a mum and enjoy being with your baby. Referrals to our service can be made by your GP, midwife, obstetrician or public health nurse.